Good morning. I think that pain management is something that a lot of my clients have come to me over the years to talk about, to learn about, and that's what I want to share with you starting this new series today. So you're going to see different fronts on the videos. Today I'm going to start with just a basic body scan. I'm going to tell you why that's so important. And then tomorrow we're going to work on a meditation that is about dissipating pain and seeing that visual of disbursement of pain. And the next day we're going to do a little bit tougher meditation, a little bit more complex. And it's about going to the pain and feeling the pain, going to a place of no pain and starting to learn to shift your mind's focus. That can really help in long-term pain management. In addition, I always want to throw some education. So some of the other things that I'm going to be talking about throughout this series is how do you communicate your pain to your medical doctor? When we can clearly communicate how the pain is, we can get better care. Okay, so we'll talk about it if it's a radiating pain, different types of pain, labels that you can give to your doctor as you specify where your pain is and if it's been getting better or not. All right, so I would encourage you to join me right now this morning. We're just going to do a quick check-in meditation, and I hope that you do this every single day if you suffer from chronic pain. So let's start by breathing in through our nose for a count of 4, hold for a count of 4, and breathe out, controlling that breath for a count of 6. Again, holding the breath, we're wanting to kind of lower the blood pressure, extending that breath out, we're wanting to calm down your nervous system. So here we go. In through your nose, 2, 3, 4. Hold, 2, 3, 4. Breathe out, 2, 3, 4, 5, 6. Now it should kind of look like this. Now, if you say, I can't breathe in that much, or I can't extend my breath that much, that's okay, but you will start to pick up on how to do that because you'll start to expand your lungs if you practice this every day. So I would like you to do 2 more, and then we're going to start our body scan. Breathing in through your nose, 2, 3, 4. Hold, 2, 3, 4. Breathe out, 2, 3, 4, 5, 6. Very good. Breathe in, 2, 3, 4. Hold, 2, 3, 4. Breathe out, 2, 3, 4, 5, 6. And now, if you are lying down in your bed, hopefully you're sitting up because that helps the breath a little bit. We can breathe a little bit easier if we're sitting up. So if you're sitting up in your chair, get kind of comfortable. Put both of your feet flat on the floor. And if you feel comfortable enough to close your eyes, I would encourage you to do that. I'm going to slow down my voice a little bit, lower it a little bit, and join with me. So right now, with your eyes closed, I would first like you to just give yourself permission to take this 5 minutes for yourself. Being empathetic to yourself is very different than feeling sorry for yourself. Just as self-care is very different than being selfish. So today I'm asking you to be empathetic to your chronic pain issues, and I'm asking you to increase your self-care by giving yourself full permission to not do anything else but this 5-minute check-in. So I want you to envision that there's like a light beam going horizontally like a scan right across the top of your head. And just bring it down a little bit. And I just want you to kind of check in with yourself. How does your forehead feel? Your temples feel? Is there any pressure on the top of your head? And try to just feel yourself from the inside out, just one portion of your body at a time as I gently lead you. Now we're going to go on. Keep on scanning down your eyes, your ears, your cheekbone, the back of your head, going down to your jawbone. A lot of times people, if they're stressed or in pain, you might have not even realized that you were kind of clenching your jaw. And if you think you are, move your mouth around, right? Move it around a little bit. If it looks funny, right? Nobody's watching. Move your mouth around a little bit. Kind of loosen that jaw. And let's keep on going down into your neck area. Is there any tightness or stiffness? And sometimes if you're not used to feeling yourself from the inside out, so to speak, then it's okay to move that portion that I'm speaking about with your body, just so that it increases your awareness of if you have pain or no pain. So when I'm saying your neck, if you're like, I can't really feel anything, then please just move your neck a little bit gently and see if you feel anything there. Very good. And let's go down to your shoulders, your back, your clavicle bone, moving down to the front, your chest, your heart. How is your breathing? Do you feel any pressure in your chest? Or are you breathing fine? Your heart feels fine. There's no pressure. Scanning down through your arms and your elbows. Is there any arthritis? Any pain, tightness in your elbows? And again, we're acknowledging it to be empathetic, but we're not concentrating on it. We're going to continue to scan down, not be afraid of the pain. We're just having an awareness of where it is today and where it isn't actually. So we're going to go down to your wrists and all the way down to your fingers, the tips of your fingers. Again, you can move them around to see if you have any sensation. Let's go up to the middle of your back and all the way down to your lower back, and your tailbone. Flip your awareness to the front. Is there anything going on digestive-wise in your stomach? Continue down to your hips and your pelvic region. How do you feel sitting on the chair? Is that comfortable? Is that painful where you are meeting the chair, where there's pressure? Going down from your buttocks into your hips, all the way down, just gently seeing that beam of light. Again, we're not afraid of the pain, of running into the pain. We're just doing an empathetic body scan. Now you're down to your knees and continue down through your calves, your ankles, the soles of your feet, Flip to the top of your feet, all the way to the end of your toes. You can wiggle them and just let that light beam go right out your toes. And now, still with your eyes closed, I want you to just think about if there were any areas of concern for you. Were there any things that you stopped because there was pain there that you want to acknowledge for yourself? Again, not feeling sorry for yourself. This is self-care and being empathetic. So you might have said, I have some pain, like a tennis elbow, or I have some arthritis in my tailbone area, or I have a headache, a slight headache coming on that could turn into a migraine later, something I would need to address. And now if you can just picture that those are your hot spots. So you can picture that, I would say, more of a gold rather than a red that people associate with pain. You can associate that as a gold or an orange color. Wherever there was 1 to 3 areas that possibly need your attention and awareness, and just picture that glowing right now. And it's not an alarm, it's not intense pain, it's just saying that's something that we need to address. Okay, and now that you have those 1 to 3 spots lit up, I want you, with your eyes closed, to take just 2 cleansing breaths to kind of release some of that pain. So we're going to breathe in through your nose, but then the out breath is going to be faster, and it's going to sound like this. Now do that twice with me. In through your nose, out cleansing breath. In through your nose, out cleansing breath. Excellent, excellent job. I want you to become aware of your surroundings and open your eyes now. Really good, great job. This is a great first step on your pain management, okay, your pain management. And now that you have your 1 to 3 hot areas that are kind of lit up, reminders in gold or orange, I would like you to take care of those, okay? And that's what this might look like. It might look like, hey, I have not been doing those physical therapy exercises at home, and I'm supposed to be standing at the edge of the counter, and I'm supposed to be like lifting up on my feet like this, and I haven't been doing that, and my feet really hurt, so I probably need to go and do that. Or it might be that my ankles really ache, and I probably need to soak them in some warm water and Epsom salt this morning. Or my back is hurting me, and so I probably shouldn't be cleaning out that top cabinet that I wanted to in my kitchen today. I need to address this back issue first, okay? And I may need to give myself permission to sit in my lazy boy for a little bit, listen to some calming music, or maybe watch a funny show that's great for pain management also, and allow myself to have that heating pad, okay? So what happens is that every morning you can do this quick scan, and you are taking care of yourself, and it is preventative medicine is what it is, right? Because if you don't recognize through that body scan that, ooh, there seems to be a tinge in my back here, maybe I need to take care of that, or ooh, I do have a little bit of pressure that could turn into a migraine, what happens is you get up, you start working, and then you really hurt your back, right? And then you're down for the rest of the day, and you're taking maybe more pain meds than you're supposed to. They don't be short at the end of the month, right? Because you can't get, pain meds until your time, your correct time as far as, picking up your pain meds, okay? Now, also with your headache, if you have some pressure, and you know that you're prone to migraines and you do that body scan, it's like, oh, okay, I wouldn't even notice that pressure, Nancy, if I wouldn't have slowed down and done that for 5 minutes. Really, I would have just got up and kept on working throughout the day. It would have been kind of a light pressure. It would have gotten worse. And then probably in the afternoon, I would have had a full-blown migraine, right? Been in pain, or maybe I have to go to the emergency room, get a shot, something, right? Or I have to get in a closed room, and I was gonna see the grandkids and now I can't because I have to close my curtains and be in a dark room and have silence, okay? So this is a great thing. This is the great thing on the first thing of the series that I want to teach you and encourage you to do, is to please, if you suffer from chronic pain, then I want you to learn to take care of yourself. And I encourage you, first thing in the morning, before you get out that to-do list of what you want to do, please do a body scan. Become aware if you have any hot spots, and feel free to address those and have a good day. I want you to learn to be your best friend, your best cheerleader, and your best advocate for both your mental and physical health. Thanks for watching.